All right, so today let's talk about non-trauma processes of the skeletal system. So mainly the diseases that affect the skeletal system. So we're going to first take a look at our list. Up first, we do have ankylosing spondylitis here. That's an inflammatory disease causing fusion of the vertebrae from one to another. Next one up is bone cyst. This is a true fluid-filled cyst, and it's usually an incidental finding, so chances are you didn't change your technique when you found this pathology. But if you do know you're looking for a bone cyst, it is a little easier to penetrate, meaning that you want to go down a little on technique. Next one up is bursitis. We see the itis there, meaning we have inflammation of the bursa. This is harder to penetrate if calcium has deposited. And we're going to take a look at an x-ray of bursitis here in a moment. Congenital hip anomaly. It's important to remember that it is a pediatric condition, and it's an anomaly of the hip, at the hip joints. Disc herniation. This is when the intervertebral discs, that nucleus pulposus in the center there, kind of leaks out. So you have a herniated portion, so letting those contents leak out, and then you start to have a patient with a lot of pain. Ewing sarcoma, that is a pediatric condition as well, easier to penetrate. So from a pediatric technique already, you'll go down a little bit again there. Giant cell myeloma and multiple myeloma. These myelomas here, in general, they're cancers of different cells which cause destruction, and then that destruction can sometimes be seen on an x-ray of different bones. Osteoarthritis, we see there, it's a type of arthritis there dealing with the bone. Because it is a destructive process, it's easier to penetrate, as a lot of these are. So again, we would go down on technique. And the next one, osteochondroma, is a benign outgrowth of cartilaginous tissue, and it can be usually pediatric or at least young adult most often. Osteogenic sarcoma, a little easier to penetrate, except for the sclerotic area. Sclerotic means kind of hardening. Osteoma is a benign round tumor, and it's a little harder to penetrate. Osteomyelitis is an inflammation of bone marrow due to infection. Osteomalacia is going to be an softening of the bone, an abnormal softening. So these both would be decrease in technique. Osteopetrosis, not to be confused with osteoporosis. The petrosis here means a kind of sclerotic bone, so again, a hardening of the bone. And that shows up real bright white. On the other hand, osteoporosis is easier to penetrate because it's a destructive process of the bone, making the bones weaker. And you see that a lot in older generations of female patients. Rickets is a pediatric disease. It's from a deficiency of vitamin D. It's an easier to penetrate pathology. We see another arthritis type here. Scoliosis is that lateral and sometimes even A to P abnormal curvature of the spine. And then, of course, we have spondylolysis, which is a defect of the area around the Z joints of the spine. Remember, we have an inferior articular process of one vertebrae and then a superior articular process of another vertebrae. So the pars interarticularis area here is affected, but you don't have displacement of these vertebrae. With spondylolisthesis, you do start to have a displacement of vertebrae. So let's go ahead and take a look at a few x-rays. This is going to be our ankylosing spondylitis that we saw there at the top of the list. And we can see here the bones have started to fuse together. Instead of seeing a clear disc space here, they have started to outgrow or do an outgrowth and start to fuse together. On the next x-ray that we see a simple bone cyst here, and we can outline it here. It often occurs near the head of the humerus or sometimes at the metaphysis of bones. On the next x-ray, we see bursitis. So that's an abnormal inflammation that we see going on here around this joint space. And this, we're looking at the elbow here. And then finally, if we look at another x-ray, we see osteoporosis. Remember, osteoporosis, we're not looking at osteopetrosis. Otherwise, these areas here that we see a lot of destruction in might look super white on osteopetrosis. So instead, we're looking at osteoporosis, and you can see it occurs a lot at the ends of long bones and also in these carpals here that we're getting a destruction of bone tissue.